Finally, a lone health worker at the only clinic in the Afram Plains area in the eastern region is begging for support just to get a solar-powered refrigerator for the facility in which he works. The Hihadzi Chips compound currently has no electricity and no refrigerator to preserve medicines, a situation that puts the lives of the hundreds of people who seek medical care there at risk. Here's a report by our own Justice Baidu.
Moses Ganke is one of the country's frontline health workers, going at it alone in one of the places where many of his mates would rarely go.
Talking about the challenges, in fact, if I want to start, I can say I may not even finish.
This is the island community of Hihadzi. It has no electricity, no potable water, and no mobile telephony network. The only clinic here was built by the villagers themselves. Moses recalls how the lack of refrigerator for medicines affects the work that he does.
Just last month, I did 5 deliveries. During delivery, you have some emergencies or complications, and those drugs that you can use to ameliorate those situations are supposed to also to be kept under coating or in the refrigerator as well. But where is the fridge? The deliveries, you have to do it because you don't have enemies. By the time you say you are referring them, they might either deliver on the bank or on the lake.
He has to travel on the sometimes turbulent Afram River using a boat, a journey that sometimes could take up to 2 hours to the nearest community that has electricity every day to store medicines like vaccines.
The facility we are not having engine boats, so I have to rely on people who are having. They don't even have commercial boats that apply to where I store the vaccines. So I have to be begging them, making arrangements. So by the time they are done, it's almost getting to see something. I am appealing to the authorities, the government, Ministry of Health, Ghana Health Service, and benevolent individual or Ghanaians. This one I'm not just appealing, I'm begging. In fact, I don't know if I should be on my knee, but maybe it will disturb your recordings. Otherwise, I will be on my knee for them to come to our aid to save these innocent children.
Moses' story is like that of many health workers in remote communities across the country. He is hoping that something changes about that soon. Justice Baidu, JoyNews, Hihadzi in the Afram Plains.
So we have to end the news tidbit now, but we do have more news, and we'll be looking at the newspapers we have in the studio. Myself, Mama Vio Swabwaji, Gifty, and then also Joseph Akable. Do stay with us.